How to identify primary versus secondary fatigue. Understanding fatigue can be especially important for those living with neurological conditions, such as brain cancer. So, how do we differentiate between primary and secondary fatigue? Let's break it down in a straightforward way. Primary fatigue is directly linked to the neurological condition itself. In the case of brain cancer, this fatigue often arises from the tumor or the effects of treatments like surgery, radiation, or chemotherapy. Patients may experience a persistent sense of exhaustion that feels overwhelming and is not relieved by rest. This type of fatigue can stem from brain dysfunction, inflammation, or damage caused by the tumor. Research shows that up to 80 to 90% of brain tumor patients report experiencing this fatigue during or after their treatment. It can also be more severe than typical tiredness and may correlate with disease progression. On the other hand, secondary fatigue is influenced by factors that are not directly related to the tumor but are still connected to the overall experience of managing the condition. This could include side effects from medications, sleep disturbances, depression, or other health issues. Unlike primary fatigue, secondary fatigue can fluctuate based on these external factors. For instance, if a patient is dealing with insomnia or feeling depressed, their fatigue may worsen. However, addressing these underlying issues can often lead to improvements in fatigue levels. To identify which type of fatigue a patient is experiencing, healthcare providers typically conduct a thorough evaluation. This includes taking a detailed patient history and assessing symptoms. Primary fatigue tends to be more constant and linked to the tumor's activity or treatment phases. In contrast, secondary fatigue may change with mood, sleep quality, or medication adjustments. Using validated fatigue assessment tools can help quantify the severity of fatigue and its impact on daily life. It is also crucial to screen for depression, sleep disorders, and medication side effects. Sometimes, imaging or neurological exams can provide insights into whether fatigue is related to tumor progression or treatment effects. For patients with brain cancer, recognizing whether fatigue is primary or secondary can guide effective management strategies. Primary fatigue may require approaches like energy conservation techniques, physical therapy, or medications specifically targeting fatigue. On the other hand, managing secondary fatigue involves addressing contributing factors, such as improving sleep hygiene or treating depression. Both types of fatigue can significantly affect quality of life and daily functioning, making accurate identification essential. In summary, primary fatigue is a direct result of the tumor and its treatment, characterized by severe exhaustion that does not improve with rest. Secondary fatigue arises from other treatable factors, such as medication side effects or mood disorders. Understanding these differences through careful assessment can lead to better management and improved well-being for patients. Always remember to consult healthcare professionals for personalized advice and treatment options.